Hello everyone, I'm Tom Boterberg. I'm a radiation oncologist at Ghent University Hospital in Belgium, and today it's the 11th of November 2020, and I have the pleasure to interview Joeri Mul for this first edition of the newsletter of the SciUp Europe Radiation Oncology Working Group. I've known Joeri for a couple of years now, but I think it's better he introduces himself. So Joeri, can you tell us who you are?
Of course, thank you, Professor Boterberg, and thank you for allowing me to tell a little bit about my work here today. My name is Joeri Mul. I'm a medical doctor and PhD candidate at the Prinses Maxima Center for Pediatric Oncology, as well as the University Medical Center in Utrecht, the Netherlands. And my research is entitled Towards Highly Conformal Flank Irradiation Using Novel Target Volumes in Pediatric Renal Tumors. I am being supervised by Professor Marie van der Heuvel, Martine van Grootel, who are both pediatric oncologists, as well as Geert Janssens, who is a pediatric radiation oncologist.
Right. So you've been working for some time already. Could you briefly outline the different steps that were involved in your project?
Yes. So the main topic of my research project is actually the implementation of new radiotherapy techniques for flank irradiation in these children. And the project consisted actually of 5 separate investigations that were performed partially at our local institution, but also on an international level. So I think the main topic of my research project has been a collaboration between multiple radiation oncologists across Europe who are affiliated to the SciUp RTSG group. And together with this group, we've had very many video conference meetings over the last years in order to establish a new target volume for these new radiotherapy techniques. So the second research project was a research project we performed at our local institution, and it involved the implementation of surgical clips to optimize this new target volume. And the third research project we performed was to determine whether this new radiotherapy techniques could be of benefit compared to the conventional methods. So what we wanted to see is how does the dosimetry, so how does the dose distribute across the body in multiple patients when comparing this conventional technique with this newer technique. However, as I said, there are 2 ongoing research projects that are almost at the final stage of analysis and interpretation. And one of these research projects involves a very large international study we've performed, in which we've looked at whether different radiation oncologists across Europe were able to develop a target volume identically. So what we did, we distributed 6 renal tumor cases among 10 radiation oncologists. Among one of those was yourself, luckily. And these results have been analyzed, and what we've shown is that still with this novel technique is something what we maybe expected a little bit, but there has been some variation among all the clinicians, and also this variation could lead to an underestimation of what we want to irradiate. So I think it's very important to establish some sort of centralized review, or which is already performed for renal tumors for pathology and for imaging radiology, but I think it could also be of benefit for this novel radiotherapy technique. And the final project, what we are analyzing now as well, is looking at our own institution. Patients have been treated with new radiotherapy techniques since 2015. And I think for now, it doesn't show an increase in local recurrences, which is something which could have happened due to the smaller radiotherapy field. Local recurrences that did occur, they did not appear to be avoidable by any other technique.
Okay, that all sounds very promising and attractive. What do you consider to be the most important and interesting perspectives related to your research?
And I think it would be very important to see how this radiotherapy technique performs on a larger scale. So what I've known is that there are ideas to also implement this technique during a larger prospective multi-center investigation, in which we implement these newer techniques and at the same time look at local recurrence as a primary outcome measure. A very important perspective is that during this prospective multi-center study, it's very important to implement some sort of review process because of the reasons I've already explained. Mm-hmm. And finally, a limitation of these newer technique is that it takes up to 3 to 4 hours for the radiotherapy team to develop such a new treatment plan for these patients. As some might know, there are some research projects going on deep learning and other artificial intelligence methods that might allow auto-contouring. And I think that's a very interesting subject that might be investigated in the future, because this allows maybe the automatic development of target volumes. And that way it can be very time preserving for the radiotherapy team. And also because the target volumes are developed by a program or an algorithm, there is probably less variation among different radiotherapy teams at different institutions. So I think that's also a very interesting future perspective.
Mm-hmm. Another important objective for radiation oncologists is obviously also to reduce, especially in children, toxicity of radiotherapy treatments. To what extent do you think that your project could help with that?
Of course, that is the only reason why we would want to implement these new radiotherapy techniques, because the old radiotherapy technique in these children already showed promising oncological efficiency. For the evidence that is available, we have shown that these newer techniques might be able to prevent radiation to the pancreas, which is important for development of metabolic syndrome, to the spleen, which is important because some patients who receive more than 10 gray to the spleen, they require, at our institution at least, infection prophylaxis to prevent, in case of asplenia, a functional asplenia. And I think there's also a form of evidence that has to be established about radiation to the heart, because some patients treated with flanker radiation do receive radiation to the heart. And we know that a dose of more than 10 gray or a dose of more than 5 gray to more than half of the heart volume can also increase the risk of cardiac disease. There is a subsection of patients who are treated in case of high-risk disease, and these receive a dose of 25 gray. And I expect the benefit for these patients to be even greater in the reduction of late toxicity. Yes.
Mm-hmm. So that all sounds very promising and interesting. So you're about to obtain your PhD, I think.
Yes.
Usually that's an important step. That's an important step in one's life and one's career. What are your personal ambitions and professional ambitions for the next years?
So I think I'm most excited now to start my career as a clinical medical doctor as well. And I am personally, although I'm very much intrigued by radiotherapy, especially because of the last couple of years, I'm currently looking into pediatrics to start with my next clinical career. And we'll have to see where the road ends for me.
Okay, just the very last question. Do you still have any message for the pediatric?
I would urge the pediatric radiotherapy community who are involved in the irradiation of renal tumors to definitely look at our consensus statement. And I think it's also important, considering our research results, that it's important to only implement these new radiotherapy techniques when you're affiliated to a larger research group or when there's availability. So I think the main message is that it's important to be affiliated when implementing these new radiotherapy techniques.
Okay, thank you. I think that's indeed a very important message. Thank you, Joeri. It was a pleasure to take this interview from you, and I wish you all the best in your personal and professional career.
Thank you very much.